Welcome to the Catherine Vandome and Me podcast.
Hashtag hosts and the HQFM quiz and bingo software are proud to sponsor the Catherine Vandome and Me podcast. With HQFM quiz and bingo software, you can use this interactive quiz software at any venue. All you need is an internet connection. Go to hashtagquiz.co.uk for your free trial today.
Hello and welcome to Catherine Vandome and Me. I'm Catherine Vandome and I'm a stand-up comedian in recovery from very severe ME. I'm also a published author and my book is out now. It's called The Truth About Me. And like today's podcast, it's all about entertainment and health. And it gives me great pleasure this morning to introduce a very, very special guest who I recently met at Dr. Perrin's annual conference. And he is an osteopath and an author. And it gives me great pleasure to bring onto today's show, Torsten Liem. Hello there, Torsten. How are you?
Hi, Catherine, or Cathy. I'm very good.
It's Cathy. You can call me Cathy, Torsten. Lovely to see you today. And it's a real pleasure to have you on because I heard your lecture, which was at Dr. Perrin's conference, and I said, I have to have this gentleman on my show. He's absolutely phenomenal. You had me laughing out loud as well because your character is very, very warm. And as a comedian myself, you really did hold that mic well. And you are from Germany, is that right, Torsten?
Yes, that's completely right.
And obviously, if you can just tell us a little bit about who you are, what you've achieved, and your official title, which I attempted to say, and I've decided to leave it to you. Your official title, Torsten, and a little bit about who you are, just to start us off on today's show.
Yes, I'm an osteopath working in my clinic in Hamburg. And basically, I did various schools in osteopathy because I was so motivated. And afterwards, I did also different universities. I did a bachelor in osteopathy. I did a master's in osteopathy. I did a master's in pediatric osteopathy. I did PhD programs. And I'm the CEO of the Osteopathie Schule Deutchland, an osteopathic educational institution. I founded the first academic programs in Germany, a master's in osteopathy and in sports osteopathy, for example. And I'm in the board of different associations, the Osteopathic Research Institute, the German Association of Pediatric Osteopathy, of the BAO, the Bundesakademie for Osteopathy, and different others. My really main heart, let's say, motivated new project is psychosomatic osteopathy, where just my book came out last year in December, and many articles I wrote already. And here I believe it could be a future for osteopathy.
Wow. And can you tell us, Torsten, thank you for that wonderful introduction and such a plethora of experience, as you say, in pediatrics as well. Absolutely phenomenal to hear all about what you have achieved, Torsten. And Dr. Perrin, obviously, as my health expert that's been helping me to get better, speaks so highly of you as well. And it's fantastic to have a fellow osteopath onto today's podcast.
It's about soma, physiology, experience of a person, and the context of a person. And all four aspects should be integrated if you diagnose and if you treat a person. And you should, of course, also integrate the psychological aspect, but it's not more and not less than the soma or the physiology or the context of a person.
Fantastic. So just to embellish on that, you understand that, and I do as well, because obviously I've written a book. But for the average layperson, just explain what that means, Torsten, in your own words, as you would if you were giving a lecture.
Yes. By the way, I also wrote a book for lay people. It was 5 months Amazon bestseller in Germany. It called
Wow.
the Osteopathic Self-Help Book. And here I really explained what I told you now, that the first thing is that people can have a choice in their life is to understand mechanisms of action of health, mechanisms of action of different sicknesses. And by understanding the mechanisms of action, you have the ability to have a choice to increase the risk for health or to increase the risk to get sick. And the second thing is you get motivated if you understand that, for example, eating bad stuff is a reason for certain risk factors in your life, or moving not enough, or moving too less, or moving too much, or whatever. And by explaining the mechanisms of action, you get also motivated and you get the discipline perhaps to look in your habits if your habits are really like what you want at the end from your life. And basically perhaps to get motivated to be a little bit more proactive in life, to change your habits in the way like you want to be. And this is the same for psychosomatic osteopathy, where I try to understand the soma, the interaction with the physiology and the interaction with the experience of a person. It means their mental thoughts, their feelings, their arousals, their needs, and so on. And of course, body sensations and the context. Yeah, we have legs, so we can choose our context. We can go away from things we don't feel it's good for us, and we can go to areas where we believe it is perhaps more healthy for us.
That's fantastic. Well, that really does explain it in much more depth. And I think that your eloquence in explaining it, Torsten, as well, was what attracted me to have you onto today's show, because you are clearly very, very educated in this field. And it's a field that I've had to dive into in my own recovery from this chronic health condition, ME. What's your connection specifically with ME, Torsten? Do you have a direct link to that specifically, or is it generalized osteopathy?
I believe if, as an osteopath, you treat persons, so you can use a general osteopathic approach. But if a person has certain sicknesses like ME, you have to understand the mechanisms of action of the pathophysiology of each sickness, to understand the risk factors, to understand what are the influences and interactions. So I don't have too much contact before with ME, but I had contact with a lot of patients of long COVID, and the mechanisms of action are overlapping. So I have a certain understanding of ME in this moment, and specifically through the treatment of patients with long COVID.
Wow. So that's very profound. So what you're saying, which a lot of medics and osteopaths are also connecting, that long COVID and ME has got a lot of overlapping symptomology. And of course, Dr. Perrin highlights that in his recent book, which explains this as well. And but your particular area of expertise, what I love about your area is you talk about the pleasure items. Go to the pleasure zones, go to the things that lift you, make you smile. And that's so important in healing from any chronic condition. And that was one thing Dr. Perrin said to myself. He said, you are one of the most toxic patients I've ever treated, but one of the most positive and happy. And I do think that if we are chronically sick, then happiness and reaching and searching, as you said, for diet, for pleasure, for good surroundings, your environment, the people that you interact with, the professionals, finding great professionals like yourself, Torsten, so that you can actually have the best opportunities to recover. Would you agree with that?
Absolutely, Kathy, absolutely. I mean, this is like our founder said, look for health. And it doesn't mean that we don't have to look for pathophysiological mechanisms of action. This is sometimes a misunderstanding in osteopathy. But looking for health, looking for what makes you lift up, looking what brings you into a flow, this is what gives you the force and the power to overcome obstacles, difficulties and challenges in life. Absolutely, yeah. I realized it in my own life, daily, really daily, and I realized it in my patients. If they really start to go what really makes them lift up, then they get the energy to overcome challenges in life.
Wow. So what you're finding with your current, as you say, long COVID/ME patients, what you're finding is that when they go towards the positivities in life, as you said about the connection with soma and osteopathy, that seems to bring elevated healing. Is that correct? And can you just give a little more in-depth discussion about that, Torsten? Because I'd rather it came from you.
Yeah. For example, everybody knows nowadays that to move is important for health. And I came from yoga. I had a yoga studio when I was young. I did different styles. I had a studio for Ashtanga yoga, which was quite challenging, body-orientated yoga. But I never would try to give a patient advice to do yoga or anything. I try to find with them together what makes them happy in a kind of whatever they want to move. Moving is the point, even not sports. We all know sports in high level has nothing to do with health. So I don't even use the word sports. I use the word you have to move in your life because your body is designed like this. Millions of years you had to move. And so find something which sparkles your heart when you think about moving, and then try to do it and make a habit out of it. Something like this.
Yeah, so what I'm hearing you say is for generalized health, because we do know with ME and long COVID, we are unable, particularly in the most severe cases like my own, we're unable to move. So that's something that couldn't necessarily resonate with us. But what you're doing is you're opening the spectrum of health to every human being globally. And you're saying that movement is a quintessential component of our health and maintaining good health. Now, I was an exerciseaholic, Torsten, so that's a really important, profound thing for me to share with you, because it does seem to be the exerciseaholics and the workaholics, as I was as well, type A personalities that get hit the hardest with this chronic condition. And of course, that's explained with Dr. Perrin. Now, how does your osteopathy help and aid anybody with a blanket case and spectrum of ill health? How does it help, Torsten?
This is really, really an important question, Kathy, because there is no generalized rule for everybody. There are some, but in a person with sicknesses, you have to adapt every advice to the pathophysiological mechanisms of action of his sickness and the capacities of a person. And as more as you're able to dose everything you do, as more you can take the person from they are coming from and help them on the way to health, to happiness, and to joy.
Okay, so what you're saying is there isn't one specific modality. There are multiple healing modalities available. And as you mentioned earlier, your pre work, which was in yoga, which can also be hugely beneficial to health as well. And we've had yoga experts on the channel. And so specifically for you, Torsten, just give us a little flavour of if somebody was to come to you with any and all health conditions. You are based, whereabouts are you based?
In Hamburg.
In Hamburg, okay. So, and do people come from all over the world to see you, Torsten? I'm guessing they probably do.
Yes, I mean mostly from Germany, but I had also people from Dubai and other countries.
Wow.
And on the other hand, I travel a lot because I give 45 workshops a year. So I travel all around. They invite me. So I see quite different people, different challenges in life from persons all over the world. Yes.
Wonderful. And what I liked in your lecture was the fact that you shared, I think, is it your wife that plays the piano? Is that correct? So tell us
Yeah,
about
that's
that,
right.
because I
That's right.
love that. That
Yeah,
really,
yeah. It started 6 years ago, and I was inspired by a teacher of mine, Weiler Freiman. She was an osteopath and had a pianist. And I said, wow, that's cool. I always wanted this also. And in a certain moment, I find a pianist, and then she played for our patients. And it was always a little bit uh, uh, joyful because I said, now comes the pianist, and the patients smiled and said, yes, yes. And then came the concert pianist inside and they said, oh, wow, it's real. And then in the beginning, she played pieces, and then she learned to play intuitive. And it is an additional factor for bringing the patients into the flow, because she tried to resonate with my treatment, with the personality and the dynamics of the patient. And yeah, it's just wonderful. Out of it, we came together and we married, by the way.
wow. Well, what a romantic story,
Yeah,
Torsten.
yeah,
And can
yeah.
I ask what her name is?
Yeah, Irina.
Alina. So
Irina.
Elena, forgive
Yeah,
me, Elena. And a big shout out to Elena, because behind every good man is a great woman.
absolutely.
And so you basically are the osteopath, and does she come into the same room as the patient and play the piano? Are you together? Is this working symbiotically?
Yes, yes. She also works by her own. She trained now as a Gestalt music therapist, but also she works with me. Yes,
Wow, that's incredible.
absolutely.
And it's not something over here in the UK that I've certainly heard of. So that was what drew me to listening to you, because I have a pianist in my family of a very high
Mm.
level. And it is wonderful to know that the beauty of mixing the arts and entertainment, which is what this channel's about, with
Mm.
healing and health, and how integral that is. So just tell me why that modality connection of
Yeah.
osteopathy and piano, why
Yes.
and how that helps, Torsten.
Yeah. I mean, it is not the only modality I integrate. Uh, when I developed psychosomatic osteopathy, the last 20 years, I also understand that there are many influence factors in life, and not only one causal factor, but many risk factors. And we act as persons multimodality. We see it in research where if one, let's say, piece of us is not working well, if we only train with one piece isolated in the beginning, it can help, but then it should be integrated with multimodal approaches like the sense organs, not only hearing by the pianist, but also the sense organ of the eyes, of the smelling, the taste, the touch, all this interconnected and dosed in a way that you resolve the dysfunctional patterns, and at the same time you guide the person to a flow state where resolving can happen. So I integrate many different multimodal factors in my treatment.
Wow. So what I'm hearing you say is that the combination of the two, as you're giving the cranial sacral healing and the osteopathy treatments, the music works in tandem with that because it stimulates all the senses in the brain and aids the healing process. Is that correct?
Yes, absolutely. Like only for seeing, when you see 34 centers in the brain are activated. So seeing is not a one process. It's involved many things. So by using colored glasses or by using a certain view or by using a movement of the eyes, I integrate and I different areas in the brain, which is connected to different areas in other parts of the body or functioning of bodies. And I integrate, for example, certain breathing aspects. We can breathe in certain areas. We can breathe that certain brain areas can get activated. So I use a lot of different aspects to bring the person into a flow that during the flow, dysfunction patterns easier could be integrated, differentiated, and perhaps resolved.
That's incredible, Torsten. Really, really incredible and unique, a very unique USP there, because I can see why people would travel from all over the world to come and see you. What's your clinic called, Torsten, and how can people find you? And I'll give a reminder at the end as well.
Yeah. Liem Institute
Okay.
and Osteopathic Clinic. Yeah,
And
it's
in
you
Hamburg, yeah?
Yes, I'm in Hamburg. The thing is, during the years, I like my clinic and I like challenges and I like when something doesn't work. And this makes me thinking deeper. Why it doesn't work, what I forgot. So long time, I was a habit that after a few years, I changed my way of treatment because I came into barriers in more complex patients. Normally, I get patients from colleagues which were stuck with. And of course, I'm not a wonder healer, so I'm just a normal person, a normal, let's say, osteopath, but I'm really always wanted to dig on or dive deeper into understanding. And my big understanding, which helped me a lot, is that I have to understand the mechanisms of action, of health, of specific sicknesses. And this gives me new entrances. And to understand that there's not one primary lesion, but there are many risk factors for health. And as more as you can somehow identify and control with your patient together and understanding the capacity of a person, which is always different, then you can really take them by the hand and guide them a certain way in your clinic to a higher degree is perhaps not the right word, but to a deeper integrative way of feeling healthy.
That's incredible. And so it's like you say, you introduce sound, soothing sound. You introduce
Smell.
Smell. Yes, tell us about
Taste.
that. Tell us about those contributions as well, because this is very unique.
Yeah, what I do is for more than 12 years is I use also heart rate variability testing. So, and even I not only tested the patient, I also tested me to see how we are interacting. And, and so I could see, for example, what kind of maneuvers change the heart rate variability in a patient. And so I found that it's not always the same. It's totally different. For some patients, it's more the taste of sweet. For others, it could be bitter. And of course, I related to the neuroanatomic working mechanisms of action. Like I know that sweet and sour is by the facial nerve registered. And salt, for example, and umami by the glossopharyngeus nerve, and bitter by the vagus nerve. And they all come together in the nucleus tractus solitarius, which is an important center also for breathing. So as I understand how things connect, I'm more free in connecting things in the treatment process. This is basically how I work. So my toolbox gets so big now that I'm really adaptive, much more adaptive to patients whenever I was before.
Wow. And these are patients, what age? Because obviously you've got pediatrics backdrop as well. Are these children
Yeah.
as well as adults, Torsten?
Yes, I mean, in children, there's a bigger difference to adults, is their proactive behavior is less as in adults, of course, because they're children. So in the children, it's more important that I integrate the parents in the treatment process,
Yeah.
because the parents are the proactive factor in this, in
Yeah. The
the treatment
provider.
of children.
Yeah.
Yeah, the
Yeah.
provider. Yes, I mean, I wrote 3 books about pediatric osteopathy. And so I'm really very, very known, and I taught a lot workshops for pediatrics, and I even developed study programs for pediatric osteopathy. But yes, I like to treat everybody. So I treat from newborns to geriatric personalities and patients, because I don't know, it makes me joy to see different variations of life, and it gives me deeper understanding of life itself if I see different ages, different patients with different ages in my clinic. And but it doesn't need to be like this. I appreciate many osteopaths who are specialized in children or in old people or in sport people. And yes, so but yes, I see everybody. I see really everybody.
That's incredible. That's incredible. And you've obviously not just one book, you have multiple books that you have written. So
Yeah.
again, that gives credence to the wealth of knowledge, Torsten, that you have. And I love the fact that you have this gentle, very humane, like Dr. Perrin, a huge humanitarian, both of you. And as Dr. Perrin said, particularly with all disease, but specifically in ME, there's a chemical, a physical, and an emotional component. And what he has found in his research is that there's a structural abnormality, a structural issue precipitating every single ME stroke long COVID patient case, affecting the drainage of the lymphatic system and the glymphatic system, which is the drainage of the brain. And as you quite rightly said a few times, this affects the flow. And in osteopathy, of course, it's all about getting the flow. Is that right? Because you're the expert. I want to hear from you, your take on that.
I would say that it's a little bit my intervention to integrate different multimodal approaches to what I mean by flow is a certain dynamic in the patient, which I can support that during this flow, obstacles can resolve. And I call this not anymore a somatic dysfunction. I call it a soma physiology experience context dynamic dysfunctional patterns, because it's all interconnected. And this was not able from our founder, A.T. Still, to understand, because all the research based on it is research from the last 20, 30 years. Even, you see, even our founder, he is incredible. I really liked his ideas about life. But you know, insulin was discovered in 1912. It was not able for Still to integrate insulin in his understanding of health. And even how sugar comes into the cell, the glucose transporters, they were discovered in 1988. So it's quite new until we know how sugar comes into the cells. But in Germany, we have 40% of people who are insulin resistant, and 10% of the population is diabetic. So 50% of people has a problem with insulin. So it's good to integrate the mechanisms of action of insulin resistance in your osteopathic treatment, I would say.
Wow. And I was hypoglycemic when I first arrived, because it's been 11 years, my journey, and 9 of those with Dr. Perrin. And when I first arrived, my blood sugar was all over the place with a Western diet, you see, and I didn't have time to eat. I was fast paced. I had 3 businesses, working on stage, of course. Meridian cycle was off. So, when people hear my story, they say, well, yeah, no wonder you got sick, because, and I collapsed age 39. So, but I'm 50 now this year, and I am recovering, but I am using, as you quite rightly said, the main core has been osteopathy. It has been the lymphatic drainage treatment with Dr. Perrin. And because I have secondary Ehlers-Danlos syndrome, my rib, my pelvis, my knee, my joints can suddenly sublux, you see. So he's having to pop them back in. So as much as I start to heal and recover, unlike just somebody with just ME, for example, unfortunately, my joints can suddenly pop out. And I was a ballerina in my youth as well. So a very highly energetic sports athlete and entertainer, and somebody who didn't sit still. So I always get this message across, because we are often called malingerers. And I encourage anybody to read my book, The Truth About Me, because even reading it exhausted me, Torsten, and you may also enjoy reading the story, because I'm a comedian. I've written it in a comic way, and I hope it entertains as well as provides positivity. And people who've met me, and today it's been a joy meeting you, because people kind of there's a stigma, isn't there, with ME stroke long COVID? There's a huge stigma attached to it, that it's lazy housewives that can't be bothered, that this, that, and the other, all this stigma of over 100 years. And I myself campaigned through Parliament, Torsten, and I took Dr. Perrin to Parliament with my ex-Minister of Defence, which was Mr. Wallace, who came to visit me at my home. And I fought and campaigned, as did so many people globally, to change the NICE guidelines from psychological to physiological. And we won collectively all over the world. So many other people before me and with me are fighting for this campaign. So what would you say to anybody who's been diagnosed today, Torsten, with ME and long COVID? What would you say to them would be the fundamentals of their recovery starting point?
I mean, first of all, what you experienced with ME is the same for long COVID. A long time, it was psychosomatic. And only in the last years, by research, we found that it has really a solid basis and mechanisms of action. So what I really feel is, in this moment, the most important is that it's a real sickness. There are real mechanisms of action involved, which makes you feeling sick. And they can measure it nowadays, and they can explain it. So it's not only a kind of psychological disorder. If doctors telling you this, change the doctor, and really go to somebody who understands the pathophysiology of long COVID and ME, because when you have a chance that he really understand what to do with you and help you and support you in the right way. Would be my advice in this moment.
And that's your job, Torsten. And as I say, to expand beyond ME and long COVID as well, your job is to aid the recovery, as Dr. Perrin's is, to aid the recovery of any and all patients, right from babies through to the elderly, in your clinic, in multifaceted ways. And I love the fact that you mentioned sucking a lollipop or something. Just tell me a little bit about that. Is that to stimulate the taste buds to, again, activate parts of the brain? And what are the tests that you do on the patients? Because that is very intriguing.
I mean, I don't use lollipops because this is not so healthy, and I try
of course,
to
it's
avoid
sugar.
to give them ideas I try to give sweet tastes from other, like an orange, or
Okay.
yes, but no, I try not to give pure sugar.
Good.
But
I was just going to say, Torsten, because I'm very anti-sugar. I'm very
yeah,
pro-health and diet as well.
yeah,
And
yeah,
my
yeah.
next book is a diet book. So
Oh, wow, cool.
I've also had Dr. Sarah Myhill on the channel, and she is
Yeah,
very much pro-diet as well and health.
yeah,
How
yeah.
does that connect with your
Yeah,
work?
yeah, absolutely. I mean, I would say from life habits, uh, eating, moving, sleeping, and stress management are the four major factors. So, of course, in my diagnose, in my history taking, they have a place. And on the other hand, nutrition is not so difficult, I believe. I mean, it's more an emotional factor. It's a more factor how I can change my habits in a culture and environment where I always get triggered by things which are really unhealthy. And the second thing is to understand why, for example, I'm so much attracted to sugar and high calorie food. It is because during evolution it saved my life. But in the context of what is the English word of deficiencies?
Yeah,
I'd never got enough. So all my genetic being is is craving for sugar and high calorie food. But the problem is that the deficiency will not come again.
yes,
So we live in a context which is not really appropriate. So we have to use our brain to make our context personal for us in a way that it fits to our
absolutely.
bodies.
Because we used to be nutritionally deficient. There wasn't enough food to go round, as my nana once said,
Yeah,
and there was a nutritional deficiency. But the quality of the nutritional opportunities back in my nana's generation were they had what we now call organic food. They had much more natural food products,
yeah,
and what we've
yeah,
done is we've
yeah,
started to infiltrate Western diet with products that aren't even food. So anything that you
yeah.
unpack,
Nice.
unwrap, open
Mm,
is not
mm.
actually food. But we've been so indoctrinated, if you like, to
Yeah,
convince ourselves that it is. And it gives a very fast, I'm sure you agree, adrenal response and an excitement response with all the sugar and all the other poisonous toxins inside, that we have become addicted. And so we're now living in abundance, but choosing the very wrong food products. Would you agree with that?
absolutely, Kathy. Absolutely. I mean, uh, just yesterday I posted on my blog what is my daily food, and it's not difficult. I eat broccoli, I eat scrambled egg, I eat avocado, salad, and finish, and I'm happy. And I can tell you from myself, I'm so much sugar addicted that I try to reduce the situations where I eat the stuff because the next day is for me even a bigger challenge. So I really understand how difficult is it for people to change the habits. And I believe for myself, I'm like an alcohol addicted person just for sugar. And yeah, yeah. So I really completely agree. And I see it in my own life that I try to close my eyes from the context, but every time you go somewhere in the street, the smell of pizza comes in your nose. When you want to buy avocado in the market, you see when you want to pay the chocolate in your level of your eyes. For me, it is horrible, but I have 100% pure chocolate, which I bring always with me. So I get a few healthy pleasure in my mouth because to, to feel the joy is important. Don't be aesthetic. This brings down the capacity of health also. So the balance between be joyful but not unhealthy is how to say in English, my English is not perfect, you say, it's a matter of really
Balancing.
calibrate
It's
yourself.
balancing.
Yeah,
The word is balance, and your
yes.
English is incredible, Torsten, and
Thank
absolutely
you.
incredible. No, it really truly is, and your understanding as well. So the most important thing is what you're saying is bring balance. Now, when you have ME to my level, I also have what's called mast cell activation syndrome,
Yes.
electromagnetic sensitivity, and all these labels, if you like, because I had carbon monoxide poisoning in my home from a broken flue pipe for 10 years prior to collapsing. So there's so many, as you can hear, it's quite a complex case. I'm sure you would agree, one of the most complex Dr. Perrin's ever treated. And so, like yourself, I have to have incorporate multiple healing modalities. I also enjoy meditation, and that has been proven to calm down the sympathetics, because as you know, the sympathetics are fast firing in ME. The sympathetic nervous system controls the lymphatic system, and if that is already going haywire, as it is in us, and then we stimulate that with more sugar, or in my case on stage with another round of applause and a song, one has to question the whole of your life and how you're
Yeah.
living, and make fundamental changes to change. In my case, I've had to change almost everything. Would you agree with that, to get better?
Absolutely. You know, my name, Cathy, is Liem. It means live, integrated, experience, meaningfulness. So if
Wow.
in a way what you explain is to have an integrative understanding of life, and when you experience meaningfulness. And yes, it is all interconnected. And this is what I like in research, is that we understand more the interconnectedness of many things, top down and bottom up also. Like what you think can influence your breathing and your body sensations, and even your microbiome. And on the other hand, your microbiome can integrate and trigger certain emotions like depression and anxiety. And to understand all these interactions, this for me is modern osteopathy. And this is what I call psychosomatic osteopathy. So yeah, I completely agree what you're saying.
And it's interesting what you say about the microbiome, because I did the enhanced gut tests in America years ago, and they
Mm.
came back as 2/3 of the gut was damaged. Now, I'd had a lot of medication. I had repeated tonsillitis every 3 weeks from the age of 14 up until I collapsed age 39. I got it a couple more times through treatment, but I've never ever had tonsillitis since
Mm.
Dr. Perrin's treatment, which for me is unbelievable, because a lot of
Wow.
the
Yeah.
tension, as you know, is in the neck area. And of course, my neck was so swelled, it was like two golf balls. My tonsils, they turned black when I was 24. They actually turned black, and a doctor said, I've never seen anything like it. So, as you said, if the flow is not aligned, my jaw had to be realigned by Dr. Perrin, because I was a fast breech birth, Torsten. So we think that my condition most likely began from birth. I was almost a cot death. My nana saved my life. I turned blue and choked. So there was all these, as I say, they're all highlighted in my book. But once you read it, even I'm in shock, because I had to get all my
Mm.
medical notes. And once I put them all together and realized this was quite a complicated and quite a horrific story, really. And that's why I felt, if I can add comedy to it, as I do,
Mm.
and and
Mm.
hopefully
Mm.
encourage people with a positive spirit, that if I can get to this point today where I can speak to you, then
Mm.
they also have hope moving forwards, and the power of your work, Torsten, with osteopathy being such a powerful tool. What's the quality, Torsten, of osteopathy?
The quality of osteopathy from the beginning was that still put the focus on health, on well-being, and this is what osteopaths doing since when always. We look, and the big give the place for what are the mechanisms of action of health, of salutogenesis, and focus strongly on them, and don't forget the pathophysiology of diseases. I would say this is basically what Osteopath's doing it, and doing it mainly by our hands. This is also,
Yes.
I would always say, for me, I don't do anything where I can't use my hands. This can do other specialists, but I want to train my hands like a pianist trains 8 hours a day their fingers with their piano.
Wow.
And this is what, for me, is osteopathy.
So you're likening playing the piano to moving the fingers and the alignment and the keys, if you like, of the parts of the body. I love that comparison, Torsten. I absolutely think that's a very, very healing way to look at what qualities osteopathy can give to the patient. That you are a musical instrument, we are the instrument, and you are the
A
musician.
living instrument.
Yes,
Yeah.
absolutely.
Yeah.
The living instrument. That could be
Yeah.
the title of your next book,
Yeah.
Torsten.
Nice. By the
So,
way, Cathy, what reminds me when you talk about your own life is really, this is, I would like to to help to support the patient to be more proactive, because the champion in deadlift is 501 kilogram. It's enormous. We as humans in evolution decided to be weak and a little bit more smart, but with the smartness here, if we decide to be strong, we even can achieve to be extremely strong. And or the champion in Czech, the play
yes,
Czech, you know,
in
uh,
chess, or yeah,
chess. Yeah, to play blindly.
yeah,
The world record is you play with over 40 people blindly, and you win 34.5 games. This is
wow,
enormous, and you only can achieve it if you put everything into it.
yes.
Everything into it, and health is nothing different. So what I believe is a little bit a black spot in osteopathy is to put too much emphasis on the activity of the osteopath and forget to really support the proactivity of the patient, because health
Yes.
is the same like to be a champion in deadlift or in chess. You have to put everything into it to get a lot out.
And I think what I hear you saying is exactly what I had to do. Your mindset has got to be 100% on healing.
Yeah, a
So
healing warrior.
focused. And I'm very lucky because I was such a type A personality anyway,
Yeah.
set up multiple businesses, and I was always a very high achiever. So, but I have to say, this has been the hardest job of my life. So I clapped bedbound after I was doing 3 jobs a day. I was running a children's theatre school by day with 100 children, singing and dancing and acting. And then I would go on stage as a comedian and singer at night, carrying
Wow.
those heavy PA speakers you talk about. And I was only 7 stone. So I was then in a gym. I had a personal trainer, and I would carry weights heavier than sometimes it felt like than my own body weight. So I was somebody that put that strain onto the body that beyond normal. And what I've had to do is almost close off the negative dramas of people who say this is for life, including the medical profession. I was told, go home and learn to live with it. And I said, no, thank you. But thank you. I was always smiling. Thank you very much for your advice, but I'm going to go and find treatment modalities and potentially a cure. And as you say, osteopathy is not a cure, it is a support mechanism, and one of the most celebrated, I would say, because I knew nothing of osteopathy. It's not something that Western medicine certainly, engaged myself in. And so I didn't understand the qualities, the healing qualities of it. But as you quite rightly said, it's the patient's mindset is number one. And I think that when the patient truly wants to recover, then they come and knock on your door. And that's step one. Would you agree with that?
Absolutely. Already by knocking in the door is part of a treatment.
Yeah.
Absolutely. And sometimes, it takes a week and sometimes it takes 3 years. And it's also my responsibility to tell the patient my vision. I could imagine we can help you, but it takes 2, 3 years. Sometimes I believe because the allostatic load, let's say the level of risk factors and the level of dysfunctional mechanisms of action are so interacting and so high that
Yeah.
you need a certain time to slowly dissolve it in a way. And yeah, sometimes it takes a while, like in your
Like my
case.
case, 9 years. And
Mm.
8 of those, Torsten, you won't believe this, but 8 of those were mostly weekly, would you believe?
Yeah, yeah.
And he, other I think I've had about 12 osteopaths treat me, and each and every one of them have been horrified because just a gentle Perrin technique treatment, which is a treatment for ME, would cause me to collapse. And Dr. Perrin has had to drag me out himself. I can't put one foot in front of the other. And it's
Mm.
interesting, there's a couple of times I went blind in my recovery
Mm.
as well. Lost my sight. I've got vestibular damage as well, inner ear damage. So all these different dysfunctional components adding to the toxic load, as you said. And if you have a very high level of toxicity in the brain, Dr. Perrin has highlighted those are the patients that are going to take longer to get better. But
Absolutely.
but you stick with it. I want to encourage everybody out there, stick with it, because living bedbound as I was is just unlivable. And I
Mhm.
wouldn't have survived if he hadn't readjusted the
Yeah,
jaw alignment, which
yeah.
was one of the big factors in my case. There's just no way that I would be here. So my feeling and encouragement today is go to see Torsten, go and get this, and his wife. I mean, what a beautiful orchestra of the two of you together working in tandem. And I also want to ask you, Torsten, if you don't mind me asking, where did you grow up, and a little bit about your parentage? What inspired you, Torsten, to get into this healing modality? Because I'd like to hear a little bit about you personally.
What inspired me was a little bit similar like your story, that I was always tired and I didn't understand why. And it was because I was so insulin resistant in my whole life. And so I was looking what can help me. And this was my challenge by myself. And now I'm no more tired nearly. And the second thing is that I wanted to find something meaningful and meaningful for myself. And I wanted to do in my professional work what is really meaningful for me. So I came really very consciously to the fact I want to be an osteopath. And basically, when I see research, patient, in Germany, men are sick 48 years of their lives, women 42. It is more than half of their lives. Statistically, we are sick. So don't feel depressive if you are sick. It is part of your life. But on the other hand, understand that 80% of these years you can change.
Yeah.
It's not genetic. And and you can change it by yourself. And if you need help, you look for help, look for other people, look for osteopaths or other doctors or healers to help you, to support you in finding the way to increase the factor of well-being.
Because when you do change your gut biome, your microbiome, your fundamental, your second brain, your tummy, when that changes for the better through diet, through the lymphatic drainage moving, the flow, as you quite rightly described it, the whole flow of the whole system functioning optimally, or certainly better, then what you find is if you are feeling down, lethargic, depressed, anxious, or any of the other secondary mental health components that go with it, they will be alleviated at the same time. Would you agree with that?
Yes, yes. At least probably. You never know what are behind the actions of the interactions, but probably there's always possibilities. And I can't say if in the beginning, if I don't know the person, what is the tools I need. For this reason, I like every osteopathic technique which exists, because which increases my ability to adapt to a person. So I really like the art of using the hands. It is
Yes.
such a fulfilling work for me in support the health in patients.
And the great thing, Dr. Perrin always highlights, the great thing about osteopathy is that in most patients, they can sometimes, their back may be misaligned, and with just one crack, they can walk out. Someone with a bad back can just walk out and be, well, not cured, you can't say cured, but as good as free and liberated from that pain. And from that release of pain, perhaps their depression or anxiety or woes also are alleviated. So it's incredible. The spine is incredible in our health. Would you agree with that, Torsten?
Yes, it's very nice how you describe osteopathic treatment in your experience with Raymond Perrin. It is in my clinic. I, with the help of me, I support the patient to be able to get reference experience or experience of reference of well-being, like we feel more flow, more wide, more can move again without pain, can think better, can digest better. And from this experience of reference, there's another step in the treatment is how to integrate it in the daily life. And this is also a big treatment step. And I see that you manage it quite cool in your way to see always how I can transfer the experience in the treatment room in your daily life. This is an important part also of a treatment. And it's also a challenging part, by the way.
Yes, yes, it is, because I had to do trauma release. I had to look at physical. I had all of those factors: emotional trauma,
Mm,
physical issues with the drainage, and also, as I say, joints popping out and etc. with Ehlers-Danlos syndrome. And then I also had an enormous high level of toxic accumulation in the whole of the body. So it has taken a much, much longer process, but I'm happier than I've ever been in my life, because I'm not as toxic. So it's and I'm also much more forgiving as well, which I think comes symbiotic with what I call, fully functioning happier state of mind, where you're much more at peace. I've never felt peaceful because I was so poisoned from birth, Torsten, and my book will highlight that. So I've never
yeah.
felt that calm,
Mm,
and being adrenalized and addicted to adrenaline on stage, which entertainers, sports athletes, and army veterans are the hardest hit with ME and long COVID, because of the stress levels put on the entire nervous system. So
mm.
what do you offer in your clinic regarding the emotional support?
First of all, I would like to give some understanding what you told about early childhood. This is also a really important risk factor. And this is not so known so long time ago. And now we know the mechanisms of action. Even when the mother has a lot of stress during pregnancies, we know now the mechanisms of action, like already in the children get and are able to get cortisol resistance. And this change with development in the brain. Or when you have really tough birth experience,
Yeah.
your serotonin conditioning is and can be changed for the rest of your life slightly. Of course, you can adapt to it, But if you have a strong, heavy, threatening birth experience, it could be like your raphe in your brainstem produce and secrete less serotonin the rest of your life, a little bit less. And of course, you can adapt to it. And by knowing these mechanisms of action, we can be more precise in the treatment process. For this reason, again, I like really research because it helps us to understand the world in a more precise way. And this helps us in the treatment also very, very much. When again, you ask me now for what I do for emotional dysregulation, it's a whole subject. I have a course, a workshop for it, for limbic influence and emotional regulation. And again, it is not isolated. You very often patients get treatment for the emotional dysregulation, and they don't forget, and they forget that the higher level is the brain who can uh, um, relativize the emotional regulation.
Yeah.
So also you should do something with your brain. And the other thing is, again, there are how to say in English, there are many factors influence the emotions, like already your microbiome can influence the your emotion level. If you have a chronic low-grade inflammation, you get the tryptophan degraded and you get less serotonin by it. It's good. It is a protection part for your brain, but on the other hand, you don't feel happy enough. So there are many factors, interacting factors, which in an integrative way to treatment of emotional dysregulation should be considered. The time here is not enough to really explain meaningful the treatment in emotional dysregulation from my point of view in psychosomatic osteopathy.
Wow. So what I hear from you is beyond osteopathy, and maybe that came from your yoga backdrop. And did anything significant happen to you, can I ask, that made you, I know you said you became poorly, but would you like to share with us anything profound that drew you towards healing others? Because usually there's something that
Yeah.
can happen to us that draws us into that field, Torsten. Do you feel comfortable to share that?
I mean, yes, perhaps a personal experience. I, I, I don't believe that yoga is the solution for everybody and everyone. I knew by myself, I did so much yoga. I did yoga for 2, 3 hours early in the morning a day. And I hurt myself so much. My back, I had 3 herniated discs, my knee, my
Really?
meniscus, and here. And yoga in itself, it appeared in a different social cultural situation. I mean, in India, people are nearly born in a lotus. In Germany, we sit on a chair. If you use certain asanas too strongly, you can hurt yourself. So it is always a question how you can adapt whatever you want to do in your personal soma physiology, experience, context, dynamic. This means
About balance, isn't it? It's
it's a
balance, Torsten.
balance to the person in itself. And
Yeah.
on the other hand, if I have very old people, and many old people now in Germany do yoga, I tell them, really, it's fine to do yoga, but you should do a little bit weightlifting. This is much more
Yes.
important
Yeah.
for your bones and your muscles than
Yeah.
just stretch yourself. So,
Yes, because your
so
muscles deplete, don't they? And so, yeah, you're
absolutely.
doing strength
One,
training.
yeah. This is the big thing. You know, when you're 45, you there's not an exact number, you decrease your amount of muscles of 1%, and 1% of muscle loss means 5% of bone loss. And here you really have to focus on it to have a cool life later on.
Wow. And because of my joints hyperextending, I always say I was once offered to be a magician's assistant, Torsten. So because I can get into very strange positions like
Yeah,
the
yeah, yeah.
exorcist, yeah, I
You
can
know,
contort.
Kathy, this is the point why I hurt myself so much. My level of my self-esteem was quite low. And then I saw these cool girls coming in, do all these strange positions. And I tried to be as good as the super cool girls to feel a little bit more self-estimation in myself. This was my dysfunctional mechanism of action of all these injuries, by the way.
So it sounds like you were a little bit of a type A personality like myself, and you wanted to
Yeah,
be
yeah.
the best that you could be. And
Yes.
that is so important in our healing journeys that, yes, it's great to have a competitive spirit because that drives you forward. But I've had to sort of almost drop that suitcase because when Dr. Perrin says, you can do one thing per day, I took that, my 100% was 500%. But I once said to Dr. Perrin, when you're draining these poisons out, please don't take my personality away. I was concerned that I was actually going to become very depressed and low because since birth, you could have
Yeah.
peeled me off the ceiling, Torsten. So I'm very blessed that I was always a very happy, jolly character. But as you say, if the balance in the brain goes one way or the other, you're not supposed to be as high as a kite every single day as I lived. So I had a very exciting life, which the book shows. What I've had to learn to do is to meditate. And I have to say, I get more pleasure now sitting in the woods, which is a brilliant way with electromagnetic sensitivity, a brilliant way to, desensitize to all the electricity. And I can actually feel an electric judder up my spine. Can you believe? My sensitivity level is so profound.
Yeah.
And my little dog, who I'll introduce you to in a second, Tinker, little Yorkshire Terrier, he also just suddenly goes, and his body, Torsten, as an osteopath, that feeling, his body just relaxes.
Mm.
And so
Mm.
it just shows we're all being
Mm.
sort of radiated
Mm.
from multiple sources, including today's podcast,
Mm.
unknowingly, which is
Mm.
also causing, as you said, this dysregulation in the central nervous system and causing extreme excitement. So, but what we need to do is perhaps take time away and have that balance. Would you agree?
Again, I have to agree, Kathy, so much. You can't imagine. Even when you mention going in the nature, going in the forest, we have now again so much really good research and so cool papers to show that forest is a multiple, and it's even for free.
Yeah,
So
yeah.
take the chance. At least already 3 hours a week is proven it helps a lot. So take the chance to be responsible for your life and enjoy happiness in the forest. Yes. And again, I heard you have a dog. Dog, even there's a cool research, lengthens lifetime and makes less chronic sick and less pain. So to have a dog already is cool for health. It's a win-win situation for both.
So, hello, Torsten. This is Tinker, and we've just been
Tinker,
talking about the profound healing benefits. Have a little guess, Torsten. How old do you think Tinker looks?
I really have no idea. 8?
He's 16 and a half. Yeah.
No.
Yeah, that's why I
Wow.
wanted to ask, because he doesn't look it. He's still got his some of his own teeth, which I
Yeah.
was told Yorkshire Terriers often will lose their teeth by the age of
Yeah.
7. Now, as soon as, because we were both poisoned with carbon monoxide, so neither of us should be here. So 10 years, you see, a broken flue pipe in the kitchen, and yet we have both encouraged each other. Love is also integral, I think, as well, but we both encouraged each other through. And Tinker now, he's a little dopier. He's just been sat by the fire, so he's a little weighted down. But I have to say, to be 16 and a half, we both changed our diets, Torsten. So that's a profound healing. I cut out all of his biscuits and sugar. Once I learnt that one dog biscuit was the same as a box of cream crackers for an adult. I had a wonderful vet who inspired me, an alternative vet. And I have to say, there's been profound health improvements in us both. So what was your thoughts that you just added about having a dog? Did you say that your life expectancy can be lifted? What was that?
Yes. The research shows it was research about dogs and cats. And in dogs, you live longer, statistically less pain, and statistically less chronic sickness.
Wow. If you have a dog. Cool. Wow. Yeah. That's incredible. And have you got a pet, Torsten? Have you got a pet in your home?
Yeah, I would like so much, but my wife said, if you get a dog, you have to take care about him at least 70%. And because I'm 55 weekends away from home. So in this life circumstances, I don't have one. But I always feel so much joy looking at dogs and seeing friends with dogs. And
there's osteopathy. There's osteopathy and healing, I feel, that you can do. I mean, I do the Perrin technique on Tinker, would you believe?
Absolutely.
So yeah, I actually, he's fast asleep, by the way. It's the first podcast where he's been fast asleep. But yeah, I do the Perrin technique on Tinker. I drain the neck area, and my partner, Mark Singleton, is a Perrin practitioner. He's also had ME, Torsten, for 30 years, would you believe? 30 years. So his entire life, he has had this condition from being about age 20, and our stars aligned where he used to push me in a wheelchair and carry me everywhere until eventually Dr. Perrin said, don't carry her because your spine is the main issue with ME. And so we both, thankfully, it was meant to be, helped each other through. So, and he's so grateful that he's now qualified, and he's now currently right now treating ME patients and long COVID patients. So talk about pay it forward. So I am really inspired by his story, which I include at the end of my book, because everybody has a story to tell, Torsten, as you quite rightly explained in your own life. You went through your own circumstances and you came out and decided to help and heal other people. So what was it specifically, Torsten, that brought you to that osteopathy in your personal circumstances?
I just wanted to do something meaningful. And something where I can, when I wake up, I feel that I do something good for me and for the world and for others. And where I can use my mind, my heart or intuition, empathy, and my hands. And basically, I know not many professions others than osteopathy, where I can all these aspects living in my daily professional life.
Yeah. And when you were younger, were your parents into holistic modalities as well, Torsten?
The side of my father were medical doctors all.
Oh, wow.
And I had when I was young, a very profound relationship. She was into natural healing and meditation. It was a girlfriend which I had when I was 18. She was 27. And she gave me a lot of inspiration for this way also, because I felt it was so much meaningful, her life. And I feel myself like you say, your balance or your flow is increased when you do something meaningful. And for me, this is my motivation for living, for life,
Yeah.
to be honest with others, to be to really be meet in an essential way where you really feel connection.
Yeah.
And in osteopathy, I can live it with all my being, even with the touch of my
Yeah.
hands. And this is just, I'm so happy to be an osteopath. Yeah.
I can feel it. It oozes from you, and I think true healers have that empathy as well. And clearly, Torsten, you have a great deal of empathy and compassion for others. And those are the selected few that go into these healing modalities, because, as you say, in all modalities, we often go through an experience ourselves, and then we come out the other side and want to share that, which is the purpose of today's channel. It's all about celebrating the lives of people like yourself who are all over the world, and connecting us all together, because we are all one. We are all, as you quite rightly said, from a young baby right through to the elderly. We've all got different circumstances, traumas, physical issues, chemical components, different stories in that respect. But actually, human wise, the humanitarian side of osteopathy, we are all one. And I love that embodiment that comes through both yourself and Dr. Perrin. And how did you meet Dr. Perrin, can I ask?
Many years ago, I invited him to the Osteopathie Schule Deutschland to give a workshop to our teachers and clinical tutors to include his technique in our teaching clinic.
Wow. And you've been obviously close friends and companions ever since. And it was only recently that I met you, wasn't it? Which was at his annual conference. So what you embody, Torsten, in osteopathy is the mind, body and physicality. And is there any more that that you also bring, as well as the piano with your lovely wife accompanying? You said about sight and smell and how that helps heal the mind and the body. Do you offer anything else as well as that, Torsten? Or is there anything else that you can teach us and celebrate today before we have to close?
I think what is helpful for many patients or for everybody is to use some challenges, some acute stressors in life, like a short run or a short stop breathing or a short sweat or a short cold or something like this, or short stop eating, because all these acute stressors was part of our lives for millions of years, and we lost it in our normal life. So I would say if it's, I mean, for every patient you have to be adaptive, but if you're able to, instead of using escalators, you use steps, for example. I
Yes.
use always steps. And because I feel it's a wonderful challenge for myself, a joyful um, moment where I can use my body. And I'm happy because as osteopath, I'm moving all the time.
Yeah.
But you know, my patients, they sit most of the time. In the morning, they stand up and then they sit in the breakfast table. When they sit in the car, when they sit in the office, when they sit in a restaurant, they sit in the office, they sit
Yeah.
in the car, they sit in the evening dining table, and then sit in front of a television, and then they lay. What in normal nature we did millions of years, we were moving most of the time. So
Yes.
here, if you can move, move and
Yes.
do it joyfully. This is my small, joyful advice to you.
And I love that, because I've just been my partner has just got me some of those shoes where your feet can expand, Vivo
Mhm.
barefoot
Yeah.
shoes. And having dislocated my knee, I was encouraged to get some Vivo barefoot shoes and also walk barefooted, something that I perhaps had never done before, ballet shoes definitely, but not barefoot. And so now I do a lot of grounding, which is also very helpful. I have a grounding sheet on the bed, of course, and and because of the electromagnetic sensitivity, and I have to wear protective foil as I sleep and things, it's that profound, would you believe? I really encourage grounding, and I used to walk in buffalo boots, they were called. The Spice Girls used to wear them as a dancer, and they've got massive blocker heels, and I would climb up mountains as an exerciseaholic in the wrong footwear. So today I want to encourage people to walk barefooted. And also, go to the beach. I found profound healing from my dislocated knee, would you believe, just standing in the cold water in the sea. Would you agree with that?
Yes, also the cold water should be dosed in a way. And also barefoot shoes is a training shoe. I would not recommend to walk in the streets 12 hours in the shoes. I would recommend to do it perhaps better in woods, in the forests, and perhaps 1 hour or 2 hours at least to start slowly. And I saw patients who overdone it, and they created also not well-being.
That's interesting because I mean, I can't walk very far anyway with this condition, but the opposite of who I was. But I think I want to highlight that I used to do my show. I was a Jessie J tribute, and I would have 6-inch stilettos, and I would leapfrog off the front of the stage. So I would pick my PA speakers up in 6-inch heels. So thank goodness I met Dr. Perry, because I had no idea that what I interpreted as completely normal was completely abnormal. So, and because I'm petite in stature, I'm 5'2", I just always wanted to be 5'4". And in my West End auditions, you didn't get seen unless you were 5'4". So I had to invest in these big blocker shoes. But because I'm hypermobile, I could pick up the bottom of the shoe with an extra 2 inches and extend it beyond my head. Does that make sense? So now you can hear the inaccurate ways that I have overused, as you said about yoga, the overextension of the body. And Dr. Perrin has now said, you're not allowed to do, in the nicest way, Dr. Perrin has now said, I don't recommend, Cathy, that you do ballet or yoga, because what he's now trying to do is to get the joints to align and the bone, if you like, to reshape and restructure. Because I believe every 7 years, am I right, that the bone reforms? Is that correct, Torsten?
More, yes. Yes, I mean, it is what we found in research, that there are not always these exact numbers. Every person is slightly different, but more or less, yes.
More or less. And what I've found is that I used to have knees that were very much, especially as a ballerina, and the bend in the joints was profound. Since Dr. Perrin's treatment, over 9 years, of course, I can actually get my knees together like a healthy person. So there's so much more to osteopathy, isn't there? That's my love of this particular field, and why I wanted to get you onto today's show, because we have Dr. Perrin in the UK, and he travels, as you know, globally, but we also have Torsten Liem in Germany, in Hamburg, and your wealth of backdrop and information, and the reason that you got into it yourself being that you were overextending your joints, you were misaligning the body, you were doing too much, like myself, and that was causing these issues. And did you find an osteopath yourself before you trained in it, Torsten?
Yes, of course. I had the chance to see most of the old osteopaths, very famous osteopaths, and I always ask for treatment. So I wanted to feel in my body how is the hands-on work. I wanted to experience it. So I got many treatments, and of course I changed my lifestyle, and I changed my way of looking at myself and others and the world, to adapt it to a more, let's say, meaningful way of
Meaningful,
living.
balanced,
Yeah,
holistic, healthy, and optimizing your health, as I have done.
yeah,
From the inside out, basically heal from within, I call it.
yeah,
Whereas the stage was very much about the exterior and looks, and what I had to do was take all that away, take the makeup off, take the heels off, start again and look at how we used to live.
yeah.
And walk, and as you quite rightly said, intermittent fasting, it can also be very good for the average person. Dr. Perrin doesn't personally recommend it for ME, particularly
Mhm.
in the early stages, because and he doesn't recommend cold and hot treatments in the early stages as well,
Absolutely.
just while everything rebalances. But those modalities can certainly, for less severe patients, or indeed people who are then in a better state, can be very,
Mhm.
very healing as well. So get back to nature is what I hear you say. And I want you to wrap up with some beautiful poetic, I want you to wrap up, Torsten, with some beautiful words that surmise how you feel about osteopathy, and what would encourage others on their holistic health journeys ahead to come and find you.
Mm. Okay, for me, the most touching moment is when I see that patients can have a new uh, experience of reference in my clinic by treatment of multimodalities, and especially the hands contact. And then this can lead them to change their life step by step by step by step.
Wow. And so I want to say today, Torsten, it's been an absolute pleasure having you on to the Catherine Vandome and Me podcast. And I hope you've enjoyed yourself as well. It's been a pleasure getting to know you. And thank you as well for your wisdom, your insight, and your continued hands-on approach to healing that you provide globally, and specifically at your clinic, the Liem Clinic in Hamburg, with your beautiful wife, who is classically trained and accompanies you in your modality on the piano. So to both of you, thank you so, so much for all you do to help save lives. And once again, a huge thank you for coming on to today's podcast today. And I'll leave the last words with you.
Thank you so much, Cathy. I wish you a wonderful day.
Thank you so, so much. God bless. All the very best ahead, and enjoy the rest of your holiday. Thank you so much, Torsten.
Thank you,
Bye-bye.
Cathy.
Bye-bye,
Bye.
love. Bye-bye.